All right, everyone, let's go ahead and get started. Thank you so much for joining me. My name is Sal Munoz. I am the System Implementation Manager here at All Chicago. And today we are going to be talking through the quarterly report that all delegate agencies have to submit to the Department of Family and Support Services. This is the second quarter in which we are doing an HMIS-based process. So let's look at what we have on the docket for today. So we're going to start out with a little bit of context, looking back at the feedback that you all gave us in quarter one. Then we'll be talking about how we are planning to integrate and require more information to be sourced from HMIS. What is the roadmap for us to eventually pull the information from HMIS entirely and move away from the manual process. Then we will end off that section talking about the timeline and dates of when everything is due, when reports will be made available, etc. After that, we'll talk a little bit about how you can access the report, who has access to it, how to download the report, and we'll talk a little bit about how to read the report, how to address the data, how to understand the report itself. We'll also take a look at a couple of dummy reports that we have to show you. And finally, we'll talk over some resources that are currently available to you, in particular the data support sessions that will be occurring at the end of June, actually. So we'll give you some more details on how you can register for that. So really quick, a little bit of housekeeping. We have a packed house today, and we also have a lot to cover, so I will not be unmuting anyone, but any questions that you have, please send them in through the questions function on the sidebar of GoToWebinar's application. So use the question function to send in your questions. I won't be looking at chat, nor will I be unmuting anyone. I'll be addressing your questions through the questions function. And we also have a PDF of these slides in the handout section of the GoToWebinar navigation bar. Now, one thing to note for those of you that work at domestic violence shelters or projects that don't necessarily use HMIS, we will have a template of the report sent to you for those projects that may use HMIS but don't do data entry or data input. Let us know that you need to let us know so that we can work with you in either building up the data in HMIS or coming up with a path for how we can ensure that your data is correct for this quarter and moving forward. So you can either do that by opening a ticket or shooting us an email at hmis@allchicago.org. But again, the domestic violence shelters, the shelters that do not use HMIS, we will immediately send you a template, an empty template. So we went over this a little bit in quarter one, but the reason that we are starting to begin the process of sourcing data from HMIS is so that so that we can support two main goals from the Department of Family and Support Services. One is reducing the administrative burden on agencies so that you don't have to keep this sheet, a separate sheet, ongoing as you input data. And two, so that you can improve the quality of data in our system to help make data-informed decisions. So this is really there to allow you to be able to ensure that your HMIS data is up to par, and to help DFSS make better decisions and know what the standardized workflows are for the agencies and the projects that they fund. So let's talk a little bit about the feedback that we received after quarter one. So for those of you that had participated in the previous quarter, we sent out a feedback form at the end of the process, and about 30 agencies had participated. So let's look at the results. So again, 30 agencies participated. It was a optionally anonymous survey. If you didn't want to indicate who you were, what agency you worked with, that was fine. We just wanted to hear your feedback. So of some of the numerical values that we had, we asked these 4 questions on this quarter's process. I'm sorry, on last quarter's process. So we asked if the report was simple to run, and we had an average of about 3.7. If the report was easy to understand, and that came out to about an average of 3.9, and then submitting the report was a clear process, and that was an average of about 3.4, but the total rating for this quarter's process was about 2.9. So it seems like there was a lot of, the process itself was easy, but maybe the fact that now we're pulling out information from HMIS, or the fact that, change is a difficult thing to keep account of, and there were several iterations of the report that had to go out in order to address some of the issues that came up as the greater community began to pull the reports. And so I see that I have a question. Okay. All right. So folks are asking, what was it's 3 out of, this is out of 5. So the average is 3.7 out of 5. It was on a scale from 1 to 5, with 5 being the best, 1 being the worst. So if you could understand, if the report was simple to run, 5 represents that they agree with that, and 1 represents that they strongly disagree with that. So let's go over were some of the issues that people had during that quarter. And for the most part, what we are going to be talking through are going to be more generalized. We did have several issues that people brought up regarding their own program model, very specific to their program type. We are not going to be addressing those today, but that's something that we are keeping in mind, that we've taken back to DFSS. So for the first bullet point, the rollout of the reporting changes, quarter 1 was a busy quarter. At the end of those couple of months, there were several things that agencies had to submit for, just outside of even this report. So having the change happen, a lot of people just wish that it happened in a different quarter, or in a quarter that wouldn't have as many reporting requirements, submission requirements at the same time. Everything was sort of stacked at the same time. Then the changes, there were some changes that had to happen to the report as they were rolled out. As we are moving to this new system where we're trying to base everything out of HMIS, there were some retweaks that we had to make, either because, one main tweak was looking at the performance outcomes through households instead of individuals, etc. Those are some of the things that we had to change as the process went on, and a lot of that is just because as we roll this out to a greater community, there are things that people have brought up. Then we tried to change and make those iterations as seamless as possible. Then many people had issues with the length of time it takes to pull the reports. So one major thing is that people don't understand why it has to take 24 hours to reflect the data into the next pulled report, or that folks have issues with the fact that, clicking view report may sometimes time out in their browser. They weren't able to pull their reports, etc. So that's something that we are going to be addressing later on today. Some folks talked about data glitches and the need to check data accuracy, how some data didn't match what they had in their own system or in their own process of developing the report. And compounded on that, sort of going back to the fact that Q1 was packed, is that people needed some time to correct their HMIS data. And then we had folks were not as clear on the data being sourced to inform the performance outcome measures. And then finally, the data was not captured Some folks were fearful of having to bring in data that is just not captured in HMIS. So one that we hear of constantly, or pretty consistently, I should say, sorry about that, pretty consistently are services. So people who don't use HMIS to track service transactions were concerned about the fact that they may have to now track service transactions, and that's something that we'll be addressing later on in our slides. But they were concerned that now they'd have to use this HMIS and duplicate their work in order to track services. So we'll be talking about that in a little bit. But here are some of the things that people liked about this quarter. So people thought that it was great that they could see the HMIS data and keeping up to date with it and to keep their data accurate. And some folks sort of see how there's a potential for future improvements on the different iterations that we can make and improve as your agencies start to get used to this reporting process and as we begin to refine our documentation and refine how we let you know where data is being pulled from. So again, we have been working with providers to try to identify and correct any inaccuracies that have been brought up to us. And on this webinar, we're going to be talking about how to use ART to work around some of the long report times. For the most part, we're going to be scheduling reports and sort of changing our mindsets from always clicking view reports to scheduling them instead, because that way it runs in the background. You don't have to have a browser window open so that it eventually just times out. And instead, you could just have the report run in the background, show up in your ART inbox, and you can download it easy. You can schedule it for yourself. So we'll be talking over that. Then we are going to be giving you a preview of our path forward to transition to a way to pre-populate items from HMIS. Finally, we'll be talking about guidance on how to download and submit the reports and offering additional time for individualized support. So I want to make a mention about ART. So several people in the feedback forms indicated that, why are we using ART? Why the system? But the issue with not using ART is that it's the only system that can really work for us in developing the type of complicated reporting structure that we need to have. So I think one issue that people had was not being able to see their updates the day of, right? So the way that ART works is that it operates on a nightly build. So when your information is updated today, the changes in the report won't show up until tomorrow. And the reason that is because HMIS is a gigantic database with over 20 million, with over 15 million lines of data, rows of data. It's a massive system. And so it builds every night. And this data build is what we use in ART. And no matter what, this is always going to be sort of an issue as we develop any kind of system, as we look to move towards any system that would allow us to build a report that's as complicated as this one. It's going to take a night typically for the database to be built. And another thing to mention is that you may be used to running the COC APRs or the SG capers, and those reports typically give you live updates. If you change data the same day, you can run the report and see that data reflected. Well, those reports are actually built by the vendor themselves. It's hard-coded into the system. It's not something that we can do on our end at All Chicago. The only tool we have to be able to build reports specific to our community is through ART. We do not have the same suite of tools, the same suite of access to develop the kinds of reports that HUD mandates for the COC APR or the ESG caper. So One workaround is for us to move from having this mindset of just being able to click view reports and then answer the prompts, etc. We're going to switch our mindset to scheduling reports. We want to schedule reports so that they're waiting for us when we get into the system, and so that we can have these reports come to us on a daily or weekly time frame. So let's talk a little bit about moving towards pre-population. And so for quarter two, all items will continue to be manual entry. So if you remember in quarter one, we had everything structured in this manner, where on the right-hand side, you see green cells that are populated with HMIS data, and on the left-hand side are orange cells that are typically empty. So that will continue. That process of having to either fill in the orange cells with data from the reference table or from your own sourced data source, or from your own data source, that process will continue on. So in terms of requiring you to use HMIS data, this quarter we are opting not to do that. We're opting to give you the choice to be able to confirm HMIS data, but if your information is not accurate in terms of what we're presenting to you on the reference table, then we want you to know that you can go ahead and source the data from whatever data source that you're using, but understand that we are eventually building towards sourcing data from HMIS directly. So let's look at the coming quarters and what that plan will look like. So the priority that we have is going to be the priority for exclusively pulling data from HMIS is going to be the count of participants served during the quarter, and then the characteristics of the participants. So that's the age, race, ethnicity, veteran status, and the client's chronically homeless status. That is going to be pre-populated. We are hoping for quarter three, but seeing the results from this current quarter, we will see and revisit how feasible that would be. But further along past this is going to be pulling in prior living situations, the special needs and conditions, and the primary language of the client, as well as the client's household income and benefits and their cause of homelessness. So if you remember from quarter one, some of these fields actually they're already being collected in HMIS, but it's just the way that IDHS has their own sort of data elements. So one perfect instance of that is prior living situation, where we may say a place not meant for human habitation as a prior living situation. IDHS may say client was living on the streets. So those are a little bit of apples to oranges, even though they're relatively saying the same thing. And that's something that we have to work with IDHS in order to be able to flush together. And then the non-priority pieces of data that we want to eventually move into, this, although that'll require several conversations with the community as a whole, are to talk over the project functions and the supportive services that provided by the agency. Again, one of the pieces of feedback that we heard from folks was that they want to continue to use whatever database they're using to track services, to track client notes, and not necessarily have to do that also in HMIS. So that's part of the conversation that will continue on. But just understand that we are not going to be requiring folks to have to move over to, have to use HMIS to track their supportive services anytime soon. And so now we're moving on to aligning data. And one thing to note is that in order to align the data, your agency by this point should be using this form. If you're funded by DFSS, you should be using the DFSS and IDHS supplemental form. This is additional fields of information that IDHS needs in order for their reporting to work, and it's information that that the typical entry assessment is not collecting. So you can find that form, that DFSS and IDHS supplemental form, under the Select an Assessment section in the client's entry. So you'll want to, anytime you enter new clients, or if you're exiting an old client, you want to go back to their entry, click on this assessment and complete it for them, so that it begins to pull in information into your report, so that you don't have to do as much work when having to verify the language the client speaks, or verify if the person is a pregnant teen, or if they are an ex-offender, whatever question that IDHS specifically asks that the HUD entry assessment in HMIS does not. So let's talk a little bit about the timelines we have. Unlike quarter one, there will be no carryover report due. You only have 2 reports to submit to DFSS, and that's going to be the quarterly and performance outcome reports. So if you remember, the quarterly report is going to look like the screen, to the 2 screens on the right-hand side. I'm sorry, on the left-hand side, and on the right-hand side are the screenshots from the performance outcome reports. These are the only 2 you have to worry about. And again, there's no there's no carryover report that will not be in play until quarter 3. So let's look at some of the timeline here. So tomorrow we are going to make the data detail reports available in ART. And on June 27th and on, we're going to be holding data support sessions. On June 27th, that's when we'll make the submission reports available in ART, and that is when the submission period will open. And on July 8th, reports are due. So let's talk a little bit about the report structure. So the second quarter report is similar to that of the first quarter. You'll notice that there are several sections, and that each of them have 2 tables next to each other. So there's one with an empty cell, with empty orange cells that require manual data entry, and a table with green cells that reflect information pulled from HMIS. So in this little diagram on the left-hand side, you can see that I have all of on the right-hand side, the orange and pink sections are the sections that the cells that I have to complete, that I have to manually input data into. So if I want to, I can, and if I deem it accurate, I can pull all the information from the green section here in participants served and just plug that straight into my orange cells if it fits, if it is accurate, and once I'm able to verify the information. Now, for these pink cells, they also require manual data entry. However, they are not accompanied by a reference table. These are asking for data elements that we do not collect in HMIS. So we have 2 report types. We have what you're going to be seeing is a data detail folder in the DFSS Quarterly Reporting folder in ART, and then in late June, we will have a submission folder. So let me go over what some of the reports are. So the data detail reports provide you with additional information that the submission reports do not. This really helps you identify any issues with your client data. It sort of breaks down client information, client demographics. It allows you to be able to view what kind of data is missing, how we are calculating the race indicated, how we're calculating XYZ. So the data detail reports give you several more tabs than the submission reports do. So let's talk really quickly about the quarterly entry exit report. So the quarterly details report features the following tabs. It's going to have about 6 tabs. So it'll show you the report information, which you can see in this first image on the right-hand side. It essentially shows you the start date, the end date, which program this is being run on, and the Chicago program model type. And it is essential that you have a Chicago program model type listed. This report is made with conditional logic. So if your report type is an emergency shelter, you're going to be seeing different fields than someone who has a youth transitional housing shelter or a youth transitional housing program, and your report will be different even from a person who has an outreach program or a drop-in center. So just keep that in mind. It's critical to have that Chicago program model type in there because it affects what your report looks like. Then the next tab is the entry-exit summary, and this is ultimately what's submitted to DFSS, and that'll be done through the submission reports. But the entry-exit summary is really your way of being able to see when I'm ready to submit to DFSS, what is it going to look like? And this is almost exactly what is on the submission reports that you'll have to be sending in. It pulls in client information for clients that have an entry or exit during the quarter. So it's not going to be counting the clients that are currently enrolled. It's going to be pulling in those folks that have an entry or an exit during this quarter. And then we move on to EE demographics. So EE represents entry-exit, and this lists all the demographics of clients in your project. So it breaks it down by race, gender, and we'll be actually taking a look at a dummy report itself. So I won't spend too much time talking over the report, but we'll be able to view what's on there. And then we have four additional tabs. Sorry, it was 7 tabs actually. So we have EE special needs, and this has 3 tables on there. One table that is sourcing information from the disability subassessment, another table that's sourcing information from the DFSS IDHS Supplemental Assessment, and then one that lists clients that are considered chronically homeless. So these clients would have to match the definition of chronic homelessness. So that means over 12 months of homelessness and a disability. That they are either in a place on for human habitation, an emergency shelter, or a safe haven. So those are all those factors. If you answer them in the entry assessment, those clients will be pulling into the chronically homeless section under the EE special needs tab. And finally, we have the income and benefits, and that breaks down each sub-assessment and sorts them by the clients that are entering or exiting that project. So it'll say client benefits at entry, client insurance at entry, client income at entry, client income at exit, client insurance at exit, and client insurance at and client benefits at exit. So those are how the report will be structured, and you can actually see a preview of that on the right-hand side on the top left image over here. Then we have services. If your project utilizes service transactions in HMIS, this tab will be populated with the services provided. And finally, length of stay. This looks at the start of the client's entry-exit date and compares that to the quarter's time frame. So you'll see that those clients that have maybe been enrolled since December and they're exiting in June 1st, they're going to have it's going to compare how long they stayed in your program versus this quarter. And then finally, for the performance outcome report, we have 3 tabs. So one tab is the performance outcomes A, and it comes with pre-filled green cells, and the cells that are grayed out indicate that that measure is not applicable to your program model. Performance outcomes B, these outcomes are not tracked through HMIS, and they require manual data entry. So this is not information that you'll be able to find in HMIS. So if the program model is either system facilitation, homeless prevention programs, outreach coordination, rental assistance program management, housing navigation, and mobile crisis, you're going to have to complete this tab with your own data pulled from whatever source you're using. And then finally, what makes this a detailed report is the details tab. and it provides details on the clients pulled in to calculate tab A. So the submission reports will be made available on June 27th. And really, the submission reports are just stripped down versions of the detailed reports. All the quarterly entry exit submission report just has the first two tabs from the details report, and that's just going to be the report information entry exit summary, and the performance outcomes report is going to have the performance outcomes A and B tab. So you'll notice that all the details, all the demographics, the income, all of that will be missing from these reports because they're designed so that you can just download them and send them on their way. They're not really there for you to do any kind of data cleanup or to look into data at any kind of sort. So people are telling me that they can't hear me. Is there any issue is anyone else not able to hear me? I'm not sure. I got one person who said they weren't able to hear me. So if anyone else has issues hearing me, I think it may just be on your end, Dolly. I'm not sure. Everyone else is telling me I'm good, so I'm going to continue on. My apologies for whoever isn't able to hear me, but we'll keep moving on. So now what we have from this point is going to be who can access the report. So let's talk about accessing the report. These reports are only going to be downloadable through ART and HMIS, and only a agency technical administrator with a current ART license will be able to download the report. So if you're not sure who your ATA is, email us and we will let you know who they are, but only an ATA will be able to run this report. Now, some of you may remember that last quarter we had offered an ART license to whoever wasn't an ATA. However, that doesn't work because ART requires an ATA to run it in order to be able to pull in that Chicago program model type. So unfortunately, we have to have only ATAs run this report. If your agency wants to give you ATA access, that is also fine. You just have to let us know that. So we are going to be doing a quick preview, a little bit of snapshots of how to access the report, and we're going to do a live demonstration of it. So you should see this on the upper right-hand side of your Service Point screen when you log in. There you could see that you should see something that says Connect to ART. And when you click on that Connect to ART button, it'll take you to a series of folders, and it's really just a matter of navigating to the correct folder. So here you'll see the Chicago COC reports, then you'll navigate into DFSS, and then finally DFSS Quarterly, where you will be able to see both iterations of reports. So unlike last quarter or most of the reports we have you run in ART, we're going to be scheduling the report. So why are we going to be scheduling the report? It takes a lot of time to run. This is a massive report. It may not look significant, but there's a lot of calculations. There is a lot of conditional logic embedded in the report. So it's always going to take at least 10 minutes to run. And if you try to do that in your browser, it may time out. Your browser may say, I'm not getting any information because it's processing on the back end. So it just says it's timed out. This report isn't working. And then it'll kick you out of that tab of being able to view your report. A solution around this is to schedule the report so that you can just download it as an Excel file. And additionally, a benefit to this is the fact that when you do that, the HMIS team can then shadow you and pull that report when you ask us for help. So what happened in quarter one is that people would click view report and they'd view the report, they'd download it, but then they wouldn't send it to us when we did data support sessions or when they came to us for a ticket. And so we would then have to run the report, schedule it, and have it take a long time to run. So that sort of compounds things when sitting down and doing an actual data session. So in lieu of having you email us every time you run the report yourself, just schedule it. We'll be able to pull it from your art file and work off of what you are working off of. So it is hugely beneficial for you to begin the process of scheduling the report. Now, you'll see that the title for this slide is linked to an article that teaches you how to schedule reports. So I encourage everyone to look into that. But we are going to jump into this really quick. So if you are going to schedule a report, you will click on either one of the magnifying glasses, and you will then click on Schedule Report. And the only prompt you have to worry about, it looks like, people may think that they have to indicate what the EDA provider is, the effective date, the start date. All of that is pre-filled. The only thing you have to let us know is which project to run the report on. So what you'll do is you'll highlight select providers, and then you'll click on select. From there, you'll move on to this screen where you can search for your provider, and you're going to add your provider's name by clicking on the green button next to whatever project you actually have. And after selecting your project, you'll click on Next. And so this is where we move into scheduling the report itself. This looks intimidating, but it really is super simple. So the name can be changed to whatever you'd like. One thing I'd recommend everyone do is change it to, for my instance, you'll see I'm going to name mine All Chicago _ emergency shelter _ quarter report, or I could also do it for performance outcomes. You can change it to whatever name or iteration you want so that whatever makes sense to you. And then the report format should be Excel. The user inbox will automatically default to your own account, and the interval can be once. For now, I'm only going to be talking about how to schedule an interval for once, but if you look at the report, if you look at the scheduling the report article that is linked on this slide, you'll see that there's a way to schedule it to come into your inbox daily, weekly, whatever it may be. And once you have these fields set, you will click on Send. So now the report will be in your art inbox, and when you click on the magnifying glass, instead of bringing up it'll bring up a prompt asking you to download, send, organize, or delete. You'll want to download. Now, before we get into reading the report, I want to show you how to actually run it. Sorry about that. All right. And so I'm going to log in here. And you'll see that I have my Connect to Art button right up here. So I'll go ahead and click on that. And now what I'll have to do is navigate through my public folder. And almost every report that you ever have to run as someone that uses art is going to be in the Chicago COC reports secure folder right here. We'll navigate to DFSS, DFSS Quarterly. And again, note that only client detail reports is on here. The submission reports will be available later this month. So I am going to do my DFSS Quarterly Report details. I'll click on the magnifying glass, click on Schedule Report. And it immediately prompts me for the Enter Providers for Report. I'll click on Select. And I'm going to do All Chicago Emergency. And this should only be done by project. So unfortunately, you're not able to, the way that we have it set up is that each project, whatever is funded by DFSS, should be split up into an individual HMIS provider. So if you have multiple DFSS funded projects, it will be, you have to run this report for each one of them. You can't do a massive one on all of the projects that you have that are funded by DFSS. So I'm going to select on emergency shelter, click on submit, and this is the only thing I have to do. I don't have to worry about enter report start date, end date, none of that. I'll click on next. And now I move on to schedule report. And so what I'll do here is type in all_Chicago. You can change the name to reflect whatever you want. Typically, it's a pretty good idea to list the date you ran the report. The report format will be Excel. Interval will be once, and notice that the user inbox automatically defaults to myself. So you can also schedule this to run for you in the morning, whatever you'd like, but I'm just going to do it once. Click on send. And so now that I have scheduled my report, it'll be about 10 to 15 minutes before it appears in my art inbox. So like all good cooking shows, I have already prepped the turkey. You'll see here that I have previously run my emergency shelter quarterly report, and it's already here for me to go. The one that I just ran is also will also appear right here. So what I can do is just click on this magnifying glass, click on download, and it comes into me as a Excel file. So from there, I would just double click this, open it up, and begin to do some of my data troubleshooting. Now, I'm going to go back into our presentation. Now, we're going to go into talk a little bit about reading the report itself. So let's talk a little bit about reading the report. There are multiple different types of color coding in here. You'll notice that there are several green tables, orange tables, and green cells, orange cells, and pink cells. Again, the green cells means that the information was sourced from HMIS. The orange cells means that manual data entry is required, but you have a HMIS reference table to use. And the pink cells require you to do manual data entry without the use of a reference table. After that, we have gray with red text, and that just means that there's missing data. And most of the time, this is going to be related to no date of birth being input. So if your client does not have a date of birth, then we don't know whether they're a child or an adult, and we just need that information to be able to process the entire report. So anyone who does not have a date of birth will appear in these cells that have gray with red text. It just really means there's an issue here. Please go to the entry exit demographics tab. And then finally, any yellow cells are totals. Those are going to be just totals. After this, we have entry and exit reports. So this report includes clients that you served over the quarter. There are 13 sections to this, and not all program models will have to complete all 13 sections. Your template will reflect what you need to complete. So again, this is because it's going to be pulling in from whatever Chicago program model type your agency is listed as, and it'll gray out the areas that you don't have to worry about. And then finally, the performance outcomes report. This is due for everyone. And this report, again, it operates off of what your Chicago program model type is and will gray out all the sections not pertinent to your program. Now, in order to address the data, you're still going to do manual data entry. You will still have to plug in numbers into all of those orange and pink cells. Again, this is just reiterating the fact. And And this is what it looks like live. So you'll see that these are the clients that were served during the quarter. And on the orange sections, you can see the cells that are completely empty. Right next to that are the breakdowns of what we currently have in HMIS. So if you deem that accurate, then you could just plug that right into the orange cells in the table to the left. And then finally, you could see that the final section down here has information that's pre-filled. Again, this is really just reiterating the point of how you will need to use a reference table to the right. And this is a perfect example of how prior living situations can change. So you'll see on the right-hand side, this is what IDHS lists as prior living situations. And on the in the green cells, we have the prior living situations as it's recorded by HUD. You can see that for IDHS, on the left-hand side, they have emergency shelter, and for HUD, it's emergency shelter, including hotel or motel vouchers, etc. So just keep that in mind. It's really there for you to be able to make an informed decision on how you want to record your data in the orange cells. And there may be instances where you see multiple reference tables. So something like participation benefits, you'll notice that a lot of these are broken down. So you could see that we collect part of this information through the non-cash benefit subassessment and part of the information through insurance, through the insurance subassessment of that client's entry assessment. And then, of course, we have manually sourced data. So any sections highlighted in pink don't have any kind of reference table that can be sourced from HMIS. And again, if you see any clients that have no date of birth, you need to locate them and indicate what that client's date of birth is. This can be found in the details report when you look at the demographic tab. And then finally, one issue that that will still be present that we are hoping to address with IDHS is going to be that of gender and family composition. So IDHS has gender on a binary, so single female, male, female, whereas HUD data standards indicate that there can be transgender, gender non-conforming clients. And so sometimes it does not necessarily slot in directly into IDHS standards. And so one thing that we ask is that that agencies do their best to sort of input the data to fit in with the IDHS genders. Again, this is something that we are going to be following up with IDHS in an attempt to change these data elements to reflect the client's true gender expressions. And once more, a lot of your reports will be filled out when you begin to adopt the DFSS and IDHS Supplemental Assessment, and I believe most agencies at this point have been doing so. So some agencies in Q1 were not doing this, didn't know that this assessment existed. Since then, hopefully you've been doing it for every client that comes in, including children. And so once more, if you don't see this assessment, if you don't see that, if you don't see any option to select DFSS and IDHS Supplemental Assessment, please let us know and we can look into that. We can assign it to you. It's sort of critical for you to have that so that you're able to fully run the report for yourself, so that you're able to document the data required for this report. So in order to submit the report, you're going to be sending this over to Maria Lamoth, and you're going to be sending them in one email to her. Again, we ask that you change the file names to reflect your agency, your project, and whether it's a performance outcomes or a quarterly report. So you could see these 2 bullet points down here are sort of the methodology and how you should be naming your reports when you submit them. So just a quick recap, we are going to continue to work to align data elements. Each subsequent quarter will pull more information from HMIS and should require less manual data entry. You'll want to ensure that you continue to answer the DFSS and IDHS Supplemental Assessment. If you don't have access to it, let us know. But this really reduces the accuracy. It increases the accuracy in your reference table, and it reduces the amount of time that you'll have to be spending answering these IDHS specific questions or calculating them in whatever spreadsheet or database you currently have. So from there, you're going to have to fill in any orange and pink cells in your Excel sheets. This is ultimately what we look at, what DFSS looks at for the reporting. They're not going to be looking at the green reference tables. Essentially, you can copy and paste your green reference tables into the orange cells if you'd like to, but you have to go through that process of doing it. So there's going to be that manual element still, because we want to give you the option of being able to do with your data as you need to do. And you'll always want to double check your numbers, even the information sourced from HMIS. There's always a chance for errors, so we want to catch those as they happen. Now let's talk a little bit about the resources available. So to assist you with any questions that you may be having, we are going to be having a set of data support sessions. We ask that you review your data and create a ticket with us highlighting the issues you want to address, and please schedule your reports in advance. This really makes a ton of difference for yourself. It'll improve our data support session because we won't have to run your report on our end and wait 15 minutes for it to happen. We have it available, we're able to pull it, and we're able to directly jump into supporting you and your data needs. Each of the data support sessions will be 30 minutes long. It'll be done over Skype. So if you don't have access to Skype, if you're not able to use Skype, we're going to send you a Skype invitation anyway, but there's a call-in number so that you can call in if you don't have the capability to run Skype, but you should really have access to a computer. It's not helpful if you call in without access to a computer. So we want to be able to review the actual information with you. And then, of course, if you have any questions, you can email myself, but the better bet is to email HMIS@Chicago through our help desk. If you email me, I'm likely forwarding it to the help desk anyway, so that we're able to track it through our ticketing system. And any specific programmatic or reporting question can also go to Maria Lamoth, whose email is right there. And now we've come to the end of our session, and I am going to be going down the list of questions. I know we did not have much time to go over things. So there are a couple of questions regarding who can be an ATA. Essentially, whoever you want to be an ATA, we can also provide short-term ATA access to whoever needs to run this report. So just let us know. We can figure it out with you. We'll have to take it case by case. This should not be run on multiple projects. It should be one project by one project. So again, if you have multiple grants and multiple projects that are DFSS funded, do not run them all as one. Run this report on each of them. For those orange sections that don't apply to you, you could leave them blank. That's totally fine if they don't apply to you. So there may be some of those orange sections where it's like, let's say, were there any couples with children and you serve only singles? So you can leave that blank because it doesn't impact you. You don't have any couples with children. You only work with singles. Let's see. And so someone is asking, can you open the reports between 6/27? So the reports are open. You can actually access the report right now. The difference is that the submission reports, those are just essentially the first two tabs of whatever report you have. But if you need it open earlier before then, we can arrange something. But again, in order to review your data, correct information, anything of that sort, what we have, the details report is totally what you need. It's what you need to be able to do your due diligence and your data cleanup and your troubleshooting, etc. However, I also get people are on vacation, so if we need to make the submission report open before then, we can make it open before then. The reason I went with 627 is because this report is looking at folks until the end of the quarter. So if you have a client that comes in on 628, 629, they may not be in that submission report. So that's sort of where we are coming from when we open that report so late in the game. And then Joy Bradford, this report is let's see, the supplemental form. Okay, so Joy is asking, do they, for the supplemental form, do they have to do it for current clients? No. So it's only clients that are entering your project or exiting your project. That's all. Those are the only folks that this is applicable to. So I hope this has been helpful for everyone. We do have a link. We will be linking this pre-recorded webinar on our help desk. And we also already have documentation on the report itself on the help desk. I believe it's also linked under the resources on these slides. If not, I will update that. But if you go to our help desk, which is, excuse me, there we go, hmis.allchicago.org. I'll be listing it right up here so that you can easily click and review the documentation that we have available here. So with that having been said, it is 11 o'clock already. Thank you all so much for joining us today. And again, sign up for any of the data support sessions, schedule your reports, and we will be scheduling an additional webinar, and we'll be letting you know with time within the next coming days when an additional webinar to provide support will be happening. So again, thank you all so much, and we are going to be, and have a great day.